We're broadcasting live from Cooley Dickinson Hospital here with Linda Riley talking about the flu. Linda, we have a couple questions for you.
Sure.
This year's flu outbreak is now in full swing. When did flu season actually begin?
Well, this year it began a little earlier than it has the last few years, in December. We really haven't seen, though, a big spike in Western Mass, and especially in the Valley, until the last 2 weeks. The last 2 weeks we really peaked.
What makes this time of year, why does it bring a spike in flu?
Well, we just had the Christmas holidays, so everyone went home and visited families and friends and then brought their germs back with them. Students are coming back from intercession. They're bringing all their germs with them, and then everybody gets together. It's cold out. We want to be inside. We want to be together all nice and warm, and we share our love and we share our germs.
How many people have been hospitalized here at Cooley Dickinson with the flu this year?
Probably about 20 so far. I get a tally every week. We've had more admissions this year, earlier on, than we have in previous years, but we aren't seeing out of the ordinary rates just yet.
What does Cooley Dickinson Hospital do to protect patients and staff from flu infection? Maybe talk about each separately.
Okay, well, let's talk about patients first, because we're here for our patients. So, starting at all the doors, we have respiratory hygiene stations. This is an example of one. We have masks, tissues, hand sanitizer readily available. Anyone who comes in who's coughing or has the sniffles, we ask them to put a mask on. We ask everyone to clean their hands when they arrive at the hospital and again before they leave. And then we also ask our patients if they've had the flu vaccine, and if they have not had it, we give it to them during the course of their hospital stay. We also encourage our staff to be vaccinated, and in fact, that's something that we have to report to the CDC and the Department of Public Health. Any staff members that aren't vaccinated wear a mask. And the reason for this is that people can spread the flu germs before they know that they're sick. So they feel fine, they come to work, but they're spreading the germs. So by wearing a mask, that helps to prevent transmission from employees to the patients or to their peers.
So talk a little bit about the specifics of this year's flu. Is there a name for it, and where did it come from?
Okay, so this year's flu, there's been a lot of talk about both the flu and the effectiveness of the vaccine. We usually see the strain of the virus that circulates in the southern hemisphere during our summer and their winter. And this year, the virus that's predominantly circulating is the H3N2 virus. When the vaccine was formulated, it was formulated for this virus, but the virus has since mutated. So the vaccine that we give out is effective against 4 strains of flu. And unfortunately, because the H3N2 vaccine virus mutated, it's not as effective against this particular strain of the virus. We also have circulating type B flu, which is usually less severe, and usually we don't see that until the end of the flu season, but that's also circulating in the area right now. There's also a lot of influenza-like illness where people are testing negative for the flu, but they have very similar symptoms. So there are a lot of viruses out there, and we want to be sure to take good care of ourselves. We'll talk about what you can do for that in a minute.
Absolutely. So I received a flu shot earlier in the fall. How effective can I expect it to be, even if I do get the flu? Will it be less severe if I had not been vaccinated?
So it's always good to get the flu shot, even if you get the flu. And there's several interesting things about this. One, it does make you less likely to have severe symptoms and become very ill. So you will have a milder course of the illness. And secondly, by getting the flu shot, you reduce the amount of inflammation in your body, and they're finding now that that reduces your risk of heart attack and stroke. And right now, Mass General is actually doing a study about this. We also know that senior citizens that get flu shots year after year have more protection from the shots and are also less likely to become severely ill.
What would you say the common symptoms of the flu are, and at what point should I consider going to the doctor or even to the hospital if I have these symptoms?
People often ask, what's the difference between a cold or the flu? And how do I know I have a cold? How do I know I have the flu? So when you have a cold, you feel blah for a few days, you can feel it coming on, you'll say to your friends, oh, I feel like I'm getting a cold, and then you get congested and your nose starts running and you get a sore throat. When you have the flu, you have a very sudden onset of symptoms. I'm fine in the morning, I come to work, and then I'm sick as a dog. I have a headache, I have body aches, I have a fever, maybe have some respiratory symptoms, may have some upset stomach and a little bit of GI symptoms, but predominantly it's that fever, the headache, the body aches, the feeling sick as a dog. When you have the flu, you want to go home, you want to go to bed, you want to be taken care of. When you have the cold, you can kind of power through it.
Is this year's flu more dangerous to children and the elderly?
This year's flu has been particularly dangerous for children and seniors. And so it's really important, if your children haven't had the flu shot, to get a flu shot now, even though flu is circulating, and it takes 2 weeks for the vaccine to become effective, it still will provide you help. Our flu season usually lasts until well into the spring, till April or May. So there's lots of time yet that you have the potential to be exposed.
So
and then when you have these symptoms, when do you go to the doctor? Well, if you are somebody who is on medicines that suppress your immune system, somebody with arthritis, somebody with chronic lung disease, somebody with heart disease, somebody that just gets sick, if you go to the doctor, we can give you a medicine called Tamiflu, and that will help alleviate the symptoms and shorten the course of your illness. It's most effective, though, if you go in the first 48 hours, so you want to go as soon as you're really starting to feel bad and think that you have the flu.
I've heard something called a universal vaccine. Do you think this is in our future?
Well, I sure hope so. And what a universal vaccine is it's going to be a flu shot that works against all strains or types of flu, and that you would get hopefully once, but maybe just periodically in your life instead of every year. Would make it so we don't have to worry about the virus mutating. It would work on the core center part of the virus as opposed to the outer part of the virus where the mutations happen or the changes in the virus occur. And by doing this, if you have a universal shot, I think people would be more apt to just get it, because it would be a one-shot deal. You get it and you'd be done. You wouldn't have to do this every year.
So anything else to add? Anything to tell our Facebook viewers about the flu this year?
What I want to say is do the common sense stuff that your mother always taught you. So wash your hands very frequently before you eat, after you go to the bathroom, periodically during the day. Eat your vegetables, get a good night's sleep, keep your hands away from your face. The way we get sick is by putting dirty hands and germy hands that we touch on our face, and we touch our face about 200 times a day. And we make ourselves sick by getting those germs in our nose and in our mouth. So keep your hands away from your face, keep your hands clean, get your shots, get a good night's sleep, lots of fresh air and exercise, and eat your vegetables.
Thanks, Linda.
You're welcome.